and we are here at the AIBC Summit 2023 with a special medtech side to it. Right now with me, I have Michael from Stasis. Michael, how are you?
I'm good. Thank you for having me here.
Well, first of all, welcome to Dubai, because I understand you're a very recent move to Dubai. How are you finding it so far?
Yeah, just got here this week. It's my fourth time visiting.
Okay.
And so after spending a lot of time in the region and really just getting to see the mindset, you know, the openness and eagerness to really innovate, learning from a lot of what the West has done, but not being afraid to do things differently, and putting their money where their mouth is. Makes it a pretty cool ecosystem to innovate in.
Well, that's fantastic. And it's great that your first week here, you're at the AIBC Summit. I mean, this is one of the world's leading emerging tech summits. And it allows the East to meet the West and the whole world really to come together here. In fact, the number of different languages you hear as you walk along the floor is quite spectacular.
It is.
But there's one language that speaks universal throughout all people, which is health and being healthy and their vital signs. And that, whether you are from one side of the world or the other, those sort of remain consistent. But you're trying to also make sure that that data on their vital signs to get people healthy is sort of like brought to the people through connected medicine. Am I correct?
Yeah, that's exactly right. So I mean, you know, first off, I think you're absolutely correct. You know, it doesn't matter where you're from in the world, what ethnicity you are. At the end of the day, vital signs are pretty objective measurements around your health status.
Yeah.
And so our focus, we started off in vital signs. We now work with other critical data streams as well.
Okay.
And really our view has been access to quality care historically has been so defined by socioeconomics and by geography. And technology really offers this way of democratizing that in an entirely new way. And so if you look at it today, there's these large information gaps where the nurses and doctors are trying the best they can to care for their patients, but they often just don't even know there's a problem. And so what I've been so intrigued by is how do you close those information gaps to better power the care teams to actually be set up for success in caring for their patients.
Yeah, well, the more information you have, the quicker you can fix any problem. I sort of like to use it to a car mechanic today. Car mechanic doesn't really need to figure out what the issue is. He just plugs in the car, and the car now tells him this is gone, this is gone, this is not working, because there's enough sensors, enough data being relayed to the actual machine to do that. And that's hopefully one day where we'll get with medicine, that we can just sort of like plug ourselves in and we can actually find out what the problem is right away. It's no more guesswork.
Totally.
But
that sounds like the Matrix.
Yeah, but maybe not 24/7 plugged in. But when it comes down to it, so these data points, providing all this data to healthcare workers is essential in keeping people healthy. And it's been difficult, from what I understand, especially in emerging markets.
Yeah, definitely. There's a lot of challenges here, especially if you look at markets that have historically not had a lot of resources. They just have big infrastructure gaps. You know, it's a lot of very basic problems that need to be solved. It's building the roads, it's building the plumbing, it's building the electrical. Because by being able to do that, now you have the data going to the right place at the right time. And once all that data is actually available and usable, then you see all these next layer solutions being created. And especially coming out of the pandemic, we've seen a big boost in things like telemedicine and telehealth. We're here at AIBC. I mean, artificial intelligence offers a tremendous amount of potential in terms of being adopted in healthcare. But again, AI is only as good as the data coming into it, right? And so, I think a lot of us really like to think of these next level solutions, and that's what we need to be working on. But sometimes you have to take a pause and say, well, I'm limited by the fact that I don't have the right data or the right quality or the right frequency. How do we go about solving that? And so that's been a lot of what I've been really interested in trying to solve.
So what is Status doing today to help solve these issues?
Yeah. So we launched the market with a connected monitoring system. So the idea behind this is that patients, mostly in emerging markets who are outside of the ICU, would have a very simple way to keep connected to their nurses and doctors. So we built like an actual hardware monitor that's been cleared by the FDA. You know, it's a full-on medical device, and we make that data available at nursing stations, on doctors' phones. We set up big TV dashboards in the ICUs to keep them informed.
Oh, wow.
So that's what we started off with. We've cared for almost 100,000 patients at this point on that solution, and as we continue to really understand the problem of our customers and where the market's evolving, we've seen a huge opportunity where all these next layer solutions I was just talking about, these clinical softwares that are being adopted, they need the data. And so we found ourselves in a good position to be able to sit in the middle and say, there's all these different siloed data in different critical care equipment like vitals monitors and ventilators, as well as in software. And then all this software needs it. So how do we just make sure that the data gets from A to B?
Oh, fantastic. So you are the Zapier, so to speak, of the medical world. And that's fantastic. That's fantastic. And that's going to save hundreds of thousands, if not millions of lives down the road.
That's the goal.
That's fantastic to hear. So what are the big plans for 2023 for Statis?
Yeah, well, we started this conversation by saying that I just moved to the region this week. So I'm really focusing on setting this up as kind of a commercial hub for us to then be able to support the broader Central Europe, Middle East, Africa, and Asia Pacific regions. Oh, fantastic. So yeah, going to be here and really making that one happen. I'm excited about it.
And what about the AIBC conference? You've been here for 2 days. Have there been any highlights that have stood out for you?
Yeah, it's an incredible conference. You know, first off, I really love working in the medtech space, going and expanding who I'm surrounding myself by beyond just healthcare people, right? It can easily become this like echo chamber, right? And I just love walking around, seeing people from all these different places around the world, looking at all these new cutting edge technologies and how to apply them. And I think the healthcare space has a lot that can be learned from that, and AI and blockchain, gamification, and so on. You know, one highlight, you know, Gary Vee yesterday was a great chat. Loved that. He really riled the audience up. You know, the first 20 minutes, he talked a lot about the power of social media. And I thought there was something really interesting he said, which is he was describing TikTok and asked the audience to raise their hands if they had over 1 million views. And pretty much what he was saying is, okay, well, none of you guys actually have 1 million followers, but you were able to get 1 million views. That's really powerful, right? Historically, whether you're a newsletter or most social media sites, you post something and a fraction of your audience sees it. But that's actually the reverse with TikTok, where they've actually been able to get more exposure and virality than the people that were, you know, actually their viewership. And yeah, that really hit me that we are entering this new age, and we really need to be thinking about how to leverage these technology tools for brand awareness, reaching more people, and just in general getting our message across. Yep,
that's it. Getting the message across is the most important thing, and that's what we try to do with the IBC. We try to help support companies like yourselves to get your message across to the big wide world. Now, thank you very much, Michael, for joining us, and we wish you a great rest of show here for the AIBC 2023 conference. And we will be back with some more of the brightest minds from the world of blockchain and emerging tech here on AIBC.
Thank you for having me.
Thank you.